What's the best blood pressure for older adults? Know the real truth. Stop everything you're doing right now. If you or someone you love is an older adult, specifically over 70, this information isn't just important, it's potentially life-saving, and it directly contradicts almost everything you've been told about your health. For decades, a specific blood pressure number has been heralded as the holy grail of health, a benchmark doctors chase relentlessly. But what if achieving that perfect number after a certain age is actually putting you at greater risk, leading to devastating falls, hospitalizations, and even a shorter lifespan? What if the very advice meant to protect you is secretly causing harm? Get ready for a paradigm shift that will challenge conventional wisdom and empower you to take control of your well-being like never before. This isn't just about numbers, it's about safeguarding your independence and extending your vibrant years. You won't want to miss the final habit, or 99% will miss the last tip and will be stuck with dangerous blood pressure management for life. A groundbreaking study published in one of the most respected medical journals tracked over 15,000 older adults for 5 crucial years. The findings shattered long-held beliefs, revealing a dangerous disconnect between standard guidelines and real-world outcomes for seniors. What they discovered will shock you. Older adults whose blood pressure was brought down to the so-called ideal 120/80 often faced a staggering 28% higher risk of serious falls requiring hospitalization. Their mortality rates were actually worse than those with moderately higher blood pressure readings. This isn't just a slight variation, it's a dramatic reversal of what we've been conditioned to believe. Your age changes everything, and ignoring this truth could have dire consequences. Think about the quiet dangers lurking in everyday life. A seemingly harmless moment, standing up from a comfy chair, stepping out of bed in the morning, or simply turning too quickly, can become a catastrophic event if your blood pressure isn't optimally managed for your aging body. A fall isn't just a bump or bruise for an older adult, it's often a gateway to a fractured hip, emergency surgery, a grueling rehabilitation process, and far too often, a tragic loss of independence. This crucial information could literally prevent a life-altering incident for you or someone you cherish. This isn't just a theoretical discussion, it's about practical, urgent action to protect your future. Here's a scenario playing out in countless doctors' offices across the nation, perhaps even yours. A 78-year-old visits for a routine checkup. Their blood pressure reads 145/86. The doctor, following established guidelines, sees the target of less than 130 systolic and immediately reaches for the prescription pad. One medication is added, then another, meticulously bringing those numbers down. 6 months later, the doctor beams 124/78. A gold star for the patient, a triumphant success story, right? This is where the story takes a dark turn, a turn the standard guidelines completely miss. That same 78-year-old, now with their perfect blood pressure, stands up to go to the bathroom in the middle of the night. In mere seconds, their pressure plummets from 124/78 to a dangerously low 88/56. Their brain, starved of adequate blood flow, sends the room spinning. They reach out for support, but it's too late. The next thing you know, we're not talking about numbers on a chart anymore. We're talking about a devastating fractured hip, an urgent ambulance ride, weeks of painful recovery in a rehab facility, and a cascade of complications that far too often ends in a permanent loss of the life they once knew. This isn't a rare anomaly. It's a silent epidemic of preventable tragedies, all because of an outdated, one-size-fits-all approach to blood pressure. The shocking research I'm referring to was published just months ago, yet it hasn't made headlines where it matters most. In every doctor's office, in every senior center, in every home where an older adult is managing their health, most doctors are still operating on guidelines that simply don't account for the unique physiology of aging. Most patients remain completely unaware of this critical paradigm shift. This yawning gap between cutting-edge scientific discovery and everyday medical practice is costing lives, silently eroding the quality of life for millions of seniors, and it's time to bridge that gap with urgent knowledge. For decades, the mantra has been simple, almost gospel: lower blood pressure always equals better health outcomes. And for middle-aged adults, those in their 40s and 50s, that principle largely holds true. Bringing blood pressure under control in midlife is undeniably crucial for preventing future heart attacks, strokes, and kidney disease. The evidence supporting this is rock solid, undeniable. But here's the crucial turning point, the information that changes everything you thought you knew. Something fundamentally different, something deeply biological, shifts in your body after the age of 75, demanding a completely different approach. The latest, most rigorous research unequivocally demonstrates that seniors with a systolic blood pressure, that top number, comfortably, sitting between 130 and 145, actually live longer than those whose pressure is aggressively pushed below 120. Yes, you read that right. Higher within a specific range can mean a longer, healthier life. These individuals experience fewer debilitating falls, suffer fewer painful fractures, require fewer hospitalizations, and maintain significantly better cognitive function. The group that proudly achieved that textbook perfect 120/80 target, they reported higher rates of dizziness, experienced more syncopal episodes, that's the medical term for fainting, had more acute kidney injuries, and most critically, faced higher overall mortality rates. This isn't just a nuance, it's a direct challenge to deeply ingrained medical dogma. If you are someone who truly values understanding the why behind your health, who wants more than just a directive to do this or take that, then what I'm about to explain will completely revolutionize your framework for thinking about blood pressure management as you gracefully age. Your cardiovascular system at 75 is not merely an older version of your cardiovascular system at 45. It is fundamentally, irrevocably different in ways that dramatically alter what those blood pressure numbers truly signify for your health, your energy, and your longevity. Ignoring these changes is not an option if you want to optimize your health. Let me unveil the 3 critical, undeniable changes that occur within your body as you age, and precisely why these physiological transformations demand entirely different, more personalized blood pressure targets for older adults. Understanding these core mechanisms is your key to unlocking truly effective, safe, and life-enhancing senior blood pressure management, reducing your risk of a falls in elderly populations, and fostering truly healthy aging. First, consider arterial stiffness. As the years accumulate, your arteries, those vital highways for your blood, gradually lose their youthful elasticity. Picture a brand new garden hose, flexible, easily coiled, expanding slightly under pressure. Now envision that same hose after 2 decades baking in the unrelenting sun, rigid, stiff, cracking if you try to bend it too sharply. Your arteries undergo a remarkably similar process, medically termed arteriosclerosis. This isn't just cosmetic, it has profound implications for your blood flow and overall aging cardiovascular health. When your heart vigorously pumps blood into these increasingly stiff arteries, they simply cannot expand and absorb the pressure wave with the same efficiency as young, flexible vessels. This means that your aging cardiovascular system requires a slightly higher baseline pressure to ensure that adequate blood flow reaches your brain and kidneys. This becomes especially critical when you're standing upright, demanding that your blood flow defy gravity and reach vital organs. If your pressure is too low, these organs don't get the nourishment they desperately need. This is a foundational understanding for managing hypertension guidelines in older age. Second, the function of your baroreceptors declines significantly. What are baroreceptors? They are tiny, intelligent sensors nestled within your blood vessels, acting as your body's instantaneous pressure monitoring system. They detect even the slightest changes in blood pressure and instantly send urgent signals to your brain, which then triggers immediate adjustments. When a young person stands up rapidly, their baroreceptors detect the sudden pressure drop within milliseconds, prompting compensatory responses. Heart rate increases, blood vessels constrict, and pressure stabilizes, often without you even noticing. It's a marvel of physiological engineering. But as you age, these crucial baroreceptors become less sensitive, less agile. They respond sluggishly with a frustrating delay. So if your baseline blood pressure is already artificially low due to aggressive medication and your baroreceptors are already slow to react, you become a prime candidate for that dangerously sudden drop in pressure when you stand up, a condition known as orthostatic hypotension. This isn't just an inconvenience, it's a direct threat, a precursor to dizziness, disorientation, and potentially catastrophic falls, making understanding blood pressure targets for seniors absolutely vital. Third, and perhaps less discussed, is the dramatic change in medication metabolism. Your kidneys and liver, those industrious detoxifying organs, simply do not clear medications as efficiently at 75 as they did at 45. This has profound implications for your medication regimen. A dose of blood pressure medication that is perfectly appropriate, even life-saving for a middle-aged individual, can become dangerously excessive for an older adult. The medication lingers in your system for longer periods, exerts stronger, more prolonged effects, and can inadvertently push your blood pressure too low, creating a precarious situation for your overall health. This highlights the complexity of medication side effects and dosage for the elderly. Now, let's dive into the specifics of this recent paradigm-shifting research because the details truly matter for your health. The study, published in JAMA Internal Medicine, meticulously followed 15,342 adults, all over the age of 75, for an average duration of 5 years. This wasn't a group of hand-picked, perfectly healthy seniors. These were real-world older adults, encompassing individuals with pre-existing conditions like diabetes, a history of prior strokes, various forms of heart disease, and varying degrees of frailty. This diverse cohort makes the findings incredibly robust and applicable to a wide range of older individuals. The researchers diligently tracked each participant's average blood pressure, then meticulously monitored what transpired in their lives over those 5 crucial years. They categorized participants into distinct groups based on their systolic blood pressure readings. One group consistently maintained a pressure below 120, another fell between 120 and 130, a third ranged from 130 to 140, a fourth group was between 140 and 150, and finally a group whose systolic pressure was consistently above 150. The results, when compiled, painted a picture that starkly challenges long-held medical beliefs. Here's the stunning truth they uncovered. The lowest overall mortality rate, the longest survival, was observed in the group with systolic pressure maintained between 130 and 140. Not below 120, not that textbook perfect number, but rather within that moderate, often dismissed range. This is a crucial distinction that could redefine blood pressure guidelines for an entire generation. These findings underscore the critical importance of rethinking aggressive lowering strategies for the older adults' blood pressure. Conversely, those individuals whose blood pressure was aggressively lowered to below 120 experienced a significant 28% increased risk of serious falls, often necessitating hospitalization. They also suffered from higher rates of acute kidney injury, a stark indication that their kidneys were struggling to function properly with the insufficient pressure. Most alarmingly, their overall mortality rate was a startling 14% higher than those who maintained their systolic pressure in the 130 to 140 sweet spot. While the group with pressure above 150 also faced problems, as one might anticipate, higher stroke rates and more cardiovascular events, the undeniable surprise was that very low pressure was just as dangerous, if not more so, than very high pressure for this age group. The sweet spot, the truly optimal range associated with the longest survival and best overall quality of life for older adults, was unequivocally higher than conventional universal guidelines currently recommend. This isn't just academic, it has direct, urgent implications for millions of seniors managing their hypertension and aiming for healthy aging. The very numbers your doctor might be striving for could be inadvertently putting you in harm's way, increasing your arterial fall risk. Let's walk through another relatable scenario that plays out silently every single day. You're 76 years old, feeling relatively well, and you head into your doctor's office for a routine checkup. Your blood pressure reads 142/84. Your doctor, perhaps with a concerned look, consults the standard guidelines and says, "We need to get this down to at least 130, ideally closer to 120. We'll start you on a medication." 2 months later, your pressure is 128/78. Your doctor is pleased, but then suggests adding a second medication just to nudge it a little lower to reach that perfect goal. Another 2 months pass. Your blood pressure now registers a flawless 122/76. "Perfect," your doctor exclaims, genuinely believing they've achieved a health victory. You feel fine at first, but then subtle changes begin to emerge. When you stand up from your armchair to answer the phone, a momentary lightness washes over you. When you rise from the dinner table, there's a split second where the room seems to subtly tilt, a fleeting dizziness. You mention this to your doctor, who might dismiss it as just age-related, advising you to simply stand up gradually, take your time. But what's actually happening beneath the surface is far more insidious and dangerous. Your blood pressure, which looks pristine when you're sitting calmly in the doctor's office, is dropping dramatically when you transition to standing. That 122/76 sitting down could be plummeting to perhaps 95/60 when you stand up. Your brain is experiencing repeated momentary episodes of inadequate blood flow. You are now at a significantly heightened risk for a fall, a potentially catastrophic event. Yet no one is checking for this critical dynamic because your sitting blood pressure numbers look textbook perfect. This silent, preventable tragedy unfolds thousands of times daily, demanding an urgent shift in how we approach chopped blood pressure for seniors. This scenario, tragically common, is entirely preventable if we fundamentally grasp one crucial truth. Blood pressure targets must be individualized, tailored specifically to an older adult's age and functional status rather than being universally applied. A one-size-fits-all approach is not only ineffective but can be actively detrimental. It's time to move beyond generalized hypertension guidelines and embrace a personalized strategy for your aging health. Here's what's truly shocking, and it's something you can remedy immediately. There is a straightforward, simple test that takes no more than 3 minutes to perform, and it can accurately identify whether your current blood pressure medications are inadvertently putting you at a grave risk for falls. It's called an orthostatic vital sign measurement, and alarmingly, most doctors are not performing it routinely during your appointments. This test is your personal safeguard, a crucial piece of knowledge that could genuinely be life-saving. I'm going to empower you by teaching you exactly how to perform this vital test at home tonight. To conduct this essential test, all you need is a reliable home blood pressure monitor, which is readily available at any pharmacy for around $30. This small investment can yield monumental insights into your health. Here's the precise protocol, a simple 3-step process to reveal the hidden truth about your blood pressure targets and orthostatic hypotension. First, lie down flat on your bed or a comfortable couch for a full 5 minutes. Just relax, breathe deeply, and allow your body to settle. After those 5 minutes, without moving, check your blood pressure while you are still lying down. Carefully write down both numbers, the systolic, top number, and the diastolic, bottom number. This is your baseline, your blood pressure when your body is at rest and gravity isn't exerting its full influence. Second, the moment you finish that lying down reading, stand up immediately. Do not wait. As soon as you are upright, check your blood pressure again while standing. Write down these new numbers, again noting both systolic and diastolic. This rapid measurement captures your body's immediate response to the change in posture, revealing crucial information about your aging cardiovascular health, and yes, fall prevention. Strategies. Third, compare these two sets of numbers. If your systolic blood pressure, that top number, dropped by more than 20 points when you stood up, or if your diastolic blood pressure, the bottom number, dropped by more than 10 points, you have orthostatic hypotension. This is a critical red flag, a serious indicator that your blood pressure medications may be too strong for your physiology or that your current target blood pressure is dangerously low for your specific needs as an older adult. This insight is more powerful than any single sitting reading. Even if your sitting or lying blood pressure readings appear perfect by traditional standards, if it's dropping that significantly when you stand, you are at a demonstrably increased risk for falls, and the implications for your independence and safety are profound. Let me illustrate with specific numbers to make this crystal clear. Imagine your lying blood pressure registers a healthy-looking 125/78. On paper, this seems ideal. However, when you stand up, it plunges to 98/64. That's a 27-point systolic drop. This is dangerous. When you're upright, which is most of your waking hours, your brain is consistently experiencing inadequate blood flow. You might feel perfectly fine when you're lying down or comfortably seated, but when you transition to a vertical position, your body is operating on critically insufficient pressure. This is the exact test your doctor should be performing at every single visit if you are over 70 and taking blood pressure medications. If they are not, you now possess the knowledge and ability to perform it yourself and bring these vital results to your next appointment, becoming an empowered advocate for your own senior blood pressure management. So, what should your blood pressure actually be as an older adult? I'm going to provide you with the evidence-based ranges that cutting-edge research suggests are associated with the very best outcomes for different age groups within the senior population. It is absolutely crucial to understand that these are guidelines, not rigid, unyielding rules. Your individual target should always be determined through an informed, collaborative discussion with your doctor, taking into account your complete medical history, current health status, and overall functional picture. This personalized approach is the cornerstone of effective, healthy aging strategies. For generally healthy and active adults aged 65 to 74, those without major medical conditions or significant frailty, research strongly suggests that a systolic blood pressure range of 130 to 140 is both reasonable and optimal. This range provides robust cardiovascular protection, preventing the risks associated with excessively high pressure while simultaneously ensuring adequate perfusion, meaning sufficient blood flow, to all your vital organs. This nuanced target acknowledges the subtle changes of early aging without overcorrecting. For adults aged 75 to 84 who remain relatively healthy and active, the evidence unequivocally supports a systolic range of 135 to 145. Notice that this target is slightly higher than for the younger senior group. This critical adjustment accounts for the natural increase in arterial stiffness that occurs with advanced age and the slower, less responsive baroreceptor functions we discussed earlier. Aggressively lowering blood pressure below this range for this age group can lead to dangerous consequences and severely impact senior blood pressure outcomes and increase net fall risk. Finally, for adults over 85 or for those who are frail regardless of their chronological age, a systolic range of 140 to 150 may be the most appropriate and safest target. At this advanced stage of life, the paramount priority often shifts from aggressive blood pressure lowering to preventing debilitating falls, maintaining cognitive function, and safeguarding overall quality of life and independence. The risks associated with excessively low blood pressure far outweigh the perceived benefits of achieving perfect numbers. This is where nuanced blood pressure targets truly shine. Now, what about diastolic pressure, that crucial bottom number? For older adults, your diastolic pressure should generally remain above 65, ideally settling between 70 and 85. A very low diastolic pressure can significantly reduce blood flow to your heart muscle during its crucial relaxation phase, a period when the heart itself receives its own nourishment. This can lead to serious problems, including angina or even heart damage. If your diastolic pressure is consistently below 60, even if your systolic number appears fine, this is a critical point that absolutely warrants immediate discussion with your doctor. Consider a complex yet common real-world scenario. What happens when someone is 73 years old, living with type 2 diabetes, and has a history of one heart attack 5 years prior? Their current blood pressure is 148/86. Should they blindly aim for the conventional 120/80? Probably not, given the new research. But should they then aim for 150/90 simply because they're an older adult? Also probably not. This is precisely where individualization becomes paramount. For someone in this specific, multifaceted situation, current research suggests that a target around 130 to 135 systolic might be optimal. This range is low enough to provide essential cardiovascular protection given their diabetes and cardiac history, yet not so low that it dramatically increases their risk for dangerous orthostatic hypotension and potentially devastating falls. The key, in cases like this, is that this target must be reached gradually with meticulous, careful monitoring for any side effects every single time a medication dose is adjusted. The orthostatic blood pressure test should be checked rigorously. Symptoms must be assessed with unwavering honesty and attention. Are you experiencing dizziness, unexplained fatigue, a pervasive feeling of foggy thinking, or difficulty concentrating? These seemingly subtle symptoms are not to be dismissed as mere signs of aging. They might be urgent indicators that your blood pressure is being lowered too aggressively, even if the numbers on paper appear to be within acceptable limits. Listen to your body. It holds crucial clues about your new senior blood pressure health. And here's another vital piece of information most people and even many healthcare providers don't fully realize. Your blood pressure isn't a static number. It naturally varies significantly throughout the day, influenced by activity, stress, meals, and even emotions. One single reading of 148/86 doesn't mean your pressure is always that high. It might be a healthy 132/78 in the morning, rise to 145/84 in the evening, and fluctuate in between. What truly matters, what provides the most accurate picture for effective awasar blood pressure management quasi, is the average over time. This is precisely why home blood pressure monitoring is so incredibly valuable and empowering. It provides you and your doctor with a much more accurate, real-world snapshot of your true average pressure than occasional, isolated office readings can ever offer. It helps uncover patterns and fluctuations that are invisible during a typical 15-minute appointment, giving you concrete data to advocate for personalized blood pressure targets and promoting truly healthy aging. You might now be wondering, with understandable frustration, why, if this groundbreaking research exists and is so critically important, your own doctor hasn't mentioned it. Why aren't blood pressure guidelines for seniors explicitly different and widely adopted? The answer is complex, rooted deeply in how slowly medical practice changes and the intricate, often bureaucratic, process by which medical guidelines are developed and disseminated. This slow pace in adopting new knowledge creates a dangerous lag, putting older adults at unnecessary risk. Most established blood pressure guidelines, the ones doctors commonly refer to, are built upon large, landmark clinical trials conducted over many, many years. The pivotal trials that originally established 120/80 as the universally ideal target were primarily performed in middle-aged adults, individuals in their 40s and 50s. When those impressive results were published, the guidelines were, perhaps prematurely, applied broadly and universally across all adult age groups, from young adults to the very elderly. There was a prevailing, yet ultimately flawed assumption that what's good for a 50-year-old must also inherently be good for an 80-year-old. However, over the past decade, forward-thinking researchers have intentionally started focusing their studies specifically on older populations, and what they are consistently finding is that one size absolutely does not fit all. The problem is that it takes years, often a full decade or more, for robust new research to filter into official clinical guidelines, and even longer for those updated guidelines to fundamentally shift entrenched clinical practice at the individual doctor's level. Many doctors are still, understandably, operating based on guidelines that were published 5 or even 10 years ago. They simply haven't yet seen or fully absorbed the very recent research that definitively suggests moderate blood pressure elevation is actually safer and more beneficial for very old adults. This critical information gap is a silent threat to SALP's senior blood pressure management. There's also a significant psychological factor at play. For countless decades, doctors have been rigorously taught, almost indoctrinated, with the powerful message that lowering blood pressure saves lives. This message has been drilled in, reinforced by countless studies in younger populations. It's incredibly difficult for even the most well-intentioned physician to shift from that deeply ingrained mindset to a more nuanced, individualized approach that acknowledges sometimes moderate elevation is okay. Sometimes it's even preferable for older adults. It requires doctors to think critically, contextually, about each unique individual patient, rather than simply applying a universal target. And in our current healthcare system, where doctors are often allocated a mere 15 minutes per patient, that individualized, deeply critical approach is incredibly challenging to implement consistently, perpetuating suboptimal hypertension guidelines. Let me vividly illustrate just how vastly different two people of the exact same chronological age can be and why a universal blood pressure target is a dangerous fallacy. Imagine two individuals, both precisely 81 years old, but whose life, situations, and medical contexts couldn't be more divergent. The first person is living independently, generally doing well, but actively managing several chronic conditions: mild heart failure, chronic kidney disease at stage 3, and persistent osteoarthritis that limits their mobility. Their blood pressure reads 158/88. Their doctor, following standard protocols, wants to initiate aggressive treatment to bring it below 130. Now consider the second person. Also 81 years old, but they are remarkably healthy, incredibly active, playing golf twice a week, and have no significant medical problems whatsoever. Their blood pressure also reads 158/88. Same number, same age, but their underlying risk profiles and physiological needs are dramatically, fundamentally different. This stark contrast underscores the critical need for personalized blood pressure targets. One shore healthy aging, For the first person, the 81-year-old with multiple complex conditions, immediately starting multiple aggressive blood pressure medications carries significant, life-threatening risks. Those medications could easily lower their pressure too much, especially when standing, exacerbating their orthostatic hypotension. They could worsen their existing kidney function, leading to further complications. They could cause severe dizziness, directly increasing their fall risk, which with their osteoarthritis could result in a truly catastrophic fracture. A far more reasonable, safer approach might involve exploring lifestyle modifications first. Then, if medications prove absolutely necessary, a very low dose of a single medication with meticulous continuous monitoring, accepting a target of perhaps 140 to 145 systolic, rather than aggressively pushing towards an arbitrary 130. This is the essence of truly empathetic and effective senior blood pressure care. And second, for the second person, the healthy, vibrant 81-year-old whose blood pressure is also 158/88, that reading might warrant some form of intervention, but again, not necessarily aggressive treatment. Perhaps lifestyle changes alone, dietary adjustments, increased physical activity, stress reduction techniques could gently bring their blood pressure down to 145/84. For a healthy individual of that age, this reading might be perfectly acceptable, even optimal, without the need for any medications at all, preserving their natural vitality. Same numbers, vastly different people, demanding fundamentally different approaches. This, my friends, is what it truly means to treat the patient, not the number. This approach radically transforms hypertension guidelines for the elderly. Now let me equip you with specific, concrete action steps you can begin implementing starting tonight to proactively manage your blood pressure for older adults and dramatically reduce your shortfall risk. These are not complex medical interventions. They are practical, empowering strategies that put you in the driver's seat of your own health journey. Don't delay. Every moment counts when it comes to safeguarding your independence. First, if you are over 70 and currently taking blood pressure medications, you must immediately purchase a reliable home blood pressure monitor if you don't already own one. These are inexpensive and readily available. Commit to checking your pressure at the same time each day for at least 2 consecutive weeks, once in the morning and once in the evening. Keep a detailed written log of every reading. This consistent monitoring provides you with an accurate average and helps you identify crucial patterns and fluctuations that are invisible otherwise. This is your foundation for informed action regarding your senior blood pressure. Second, perform the orthostatic blood pressure test I meticulously described earlier. Lie down flat for 5 minutes, check your pressure, then stand up and immediately check it again. If you observe a significant drop, more than 20 points systolic or 10 points diastolic, document that finding meticulously. This is a critical piece of information to discuss with your doctor, as it directly flags potential orthostatic hypotension and a heightened fall risk, demanding a review of your current blood pressure targets. Third, conduct an honest self-assessment of your symptoms. Are you regularly experiencing dizziness when you stand up or change positions quickly? Do you feel an unexplained persistent fatigue that wasn't there before? Are you having difficulty concentrating or experiencing periods of foggy thinking? These are not simply signs of aging. They might be urgent, clear indicators that your blood pressure is being lowered too much, even if your sitting numbers appear perfectly fine. Your body is sending you signals. Learn to listen to them. Fourth, schedule a specific appointment with your doctor, not just a routine checkup, but an appointment explicitly dedicated to discussing your blood pressure targets. Do not simply accept a blanket statement that you need to be at 120/80. Empower yourself by asking precise, informed questions. What blood pressure target is truly appropriate for me given my specific age, my other medical conditions, and my overall functional status? Bring your detailed home blood pressure log. Bring your orthostatic measurements if you found a significant drop. Have an informed, collaborative conversation about your hypertension guidelines and aging cardiovascular health. Fifth, and perhaps most importantly, if you are experiencing any side effects whatsoever from your blood pressure medications, speak up immediately. Do not suffer in silence, believing that dizziness or fatigue is just part of the deal with these medications. That is a dangerous misconception. In many cases, medication doses can be carefully adjusted, different medications can be tried, or your target blood pressure can be modified to significantly improve your quality of life while still providing essential cardiovascular protection. You have the right to feel well and safe. Here's the profound advantage you now possess, the knowledge that most people, including, regrettably, many healthcare providers, do not fully grasp. You now understand that while blood pressure targets should never be universal. A 45-year-old and an 85-year-old simply should not and cannot be held to the same standard. For older adults, especially those bravely navigating life over 75, a systolic blood pressure comfortably residing in the range of 130 to 145 is strongly and consistently associated with the longest survival and the highest quality of life. You've learned that pushing your blood pressure below 120 significantly increases your risk of debilitating falls, triggers dangerous orthostatic hypotension, can lead to acute kidney injury, and potentially contributes to cognitive decline. Conversely, Consistently staying above 150 raises cardiovascular risk. The undeniable sweet spot, the optimal zone for our senior blood pressure, lies in that nuanced middle ground, a place of balance and informed decision-making. You've gained critical insight into orthostatic hypotension. Understanding that this sudden, dangerous drop in blood pressure when you stand is often far more perilous for older adults than a moderately elevated sitting blood pressure. More importantly, you've been equipped with the exact method to test for it yourself, safely and accurately, in the comfort of your own home. You now comprehend the fundamental physiological reasons why seniors require different blood pressure targets: the relentless march of arterial stiffness, the slower, less responsive baroreceptor reflexes, and the altered metabolism of medications within an aging body. Most importantly, you now possess the precise language and the empowering knowledge to have a truly informed, proactive conversation with your doctor. You are no longer just a passive recipient of medical advice. You are an informed, engaged, and empowered participant in your own healthcare journey. That newfound confidence and clarity is priceless. You are now more informed about blood pressure management in older adults than probably 90% of people your age. You understand the nuance, you grasp that one size does not fit all. If this information has brought you clarity, answered lingering questions, and given you the confidence to advocate for yourself or a loved one, then this mission has been accomplished. Subscribe. Which advice will you start applying today?